Welcome back to another episode of Mind Matters, Navigating Head Injuries and Concussions. I'm Thomas Ozbolt, an attorney with Shane Smith Law, and we have been talking with Dr. Darcy Dane, who owns Carolina Brain Center. We've been talking about the differences between a chiropractic neurologist and a medical doctor neurologist. So let's jump back in. So going back to talking about whiplash, and you talked about it sounds like you don't have to hit your head to have suffered any type of concussion or traumatic brain injury. Because I mean, something I've always kind of assumed is the hardest thing in your car most days, or most cars these days, at least, is your skull or the inside of your skull. So, so explain that a little bit. You're not having to hit your head to have suffered an injury here.
Right. So, I mean, I think the easiest way to, kind of get people on board with that is, you think about like blast injuries that veterans suffer, right? So, if somebody steps on, an IED or, their tank gets hit or whatever, there's just, anytime there's an explosive, right, there's a huge air concussive, sound concussive force. They don't hit their head, but they're concussed. Right. So no, you don't have to hit your head. You don't have to lose consciousness to have suffered a concussion. A concussion is just it's a traumatic disturbance to, violent traumatic disturbance to brain and space. With a little whiplash, you're, coming forward and you're coming back, and it's so fast. It's not like there's this concussion. It's not slow. I mean, it's fast. And so that's the issue, right? And we get the axonal stretching and things like that. It's not hard, but airbag deployment, that's, it may be soft, but, look at somebody who's got all the bruising and everything else. I mean, that's, and I'm not saying they don't save lives. They do. You're not going through the windshield or, being injected out of your car, but, even airbags themselves are, a concussive force. So.
Yeah, I actually I was in high school and I got knocked out by one. I made it through the initial impact. The airbag came out a little late, and that's what knocked me out. So it was, I can speak to that firsthand.
So
not fun.
Yep. No, definitely not.
So in terms of common concussion or whiplash symptoms, what would you say those are? I know you've talked some about vestibular, visual dysfunction, and that neurometabolic cascade. Does that cascade start with some symptoms and then you start to see other systems being affected, or?
Sure. I mean, that's going to be your initial symptoms are from that typically. It's the disorientation, the emotional lability, people just like, oh my gosh, I was shaking, crying, and it's just all that excitatory neurotransmitters that, brain's like, oh my gosh, danger, danger. Like, what just happened? Light sensitivity, noise sensitivity. Sleep is a huge issue with concussion. People, I can't sleep. I'm so tired. And I lay in bed. My brain is, racing, and I can't sleep. Some people, you have people that, they're like, oh my gosh, I'm like starving all the time. Well, talking about a metabolic cascade of concussion, you can't get glucose into the system. You have other people that are like, oh my gosh, I can't even eat. Okay, well, why? Well, I mean, I'm kind of nauseous all the time, or maybe that area of the brain got affected and, hunger is just kind of knocked out. And then, of course, then you've got the neurometabolic cascade of concussion where you still need glucose, right? So you've got the energy crisis going on. So, but I think, the biggest things that we see, from a physical perspective, you've got, neck pain, headaches. From a mood perspective, anxiety, symptoms of PTSD, because it's a traumatic event that you went through, depression, loss of focus, we start seeing cognitive things like, man, my memory is crappy. I can't find words. So we call that, it's called word blocking. Like I know what I want to say and I can't find the word that I want to say. Reaction times go down. That makes you more susceptible to concussion because you can't get out of the way. So it's, sometimes when you've got like, everybody's got the friend that's, it seems like they're just a magnet for car accidents. Well, you're not a magnet for car accidents. Your reaction time is so crappy that you can't be as a defensive driver as the rest of us, right? I mean, when I drive looking at the rear view anytime I'm coming to a stop because I'm looking for the idiot behind me texting on their phone or just not paying attention. And I'm like, yeah, they're not slowing down. And I leave enough room, and I have actually pulled off and had people hit the car that I got out of the way and they hit the next car. I mean, you got to be a defensive driver. So, or, the guy coming into your lane or, whatever it is. And it's just, if you're the magnet for car accidents, I can guarantee your brain's just not great. It's just not. You're just not getting out of the way. I mean, you look at somebody like Christian McCaffrey, right? Everybody knows him.
Yeah.
Christian's still with the Panthers, right? But,
yeah, right.
So he trains on one of the things, not at my office, but he trains on one of the things that we have at our office called the gyrostem chair. And, he's a beast, and he's got 2 lasers going, and then, he's going at max speed, and you've got to know where everything is. And it's, it's getting your whole spatial awareness around. That guy never gets hurt.
Right.
That's how great his brain is, right? So you've got, so when you look at from that perspective, right, like we all want to be human optimized because I don't want to get hurt either. So if I'm going to go out and play soccer, or I'm going to go, play basketball or baseball, whatever it is, or hockey, I want to know what's going on around me so that I can, get out of the way. Right. And so
Absolutely.
Kind of the same thing with driving is you want to be able to get out of the way. Because there's tons of idiots on the road that are, talking on their phones and texting and doing whatever else and, driving us all crazy, right? Like, come on, lady, go. We all deal with that every day. So, so reaction time is a huge thing that goes down with concussion. And we test that. There's like 3 different tests that we do just for reaction time. And we'll see brain processing speed is just... It's super low.
Talk about those. What are those 3 tests that you do for them?
So we look at saccades. So remember we talked about that's fast eye movement from one target to another. Yep. And so when a target changes, how fast do you react to get over to that target? And so optimally, we'd like to see like 200 milliseconds or below. And if you look at, so there's always like optimal levels, right? And then there's like, okay, now you're really out of range. And so we'll consider that, pathology or whatever. We like our optimal levels. I mean, we'll give a little bit of leeway depending on age and that kind of thing. But, majority of our people, they're scoring out of range. Like they're, 300 and something, I think it's 345 or something like that. That makes you like out of range. Like your brain is definitely processing slow. Like it doesn't matter if you talk to an MD or anybody can look at that and say, okay, yeah, that's out of range. So that's that testing. And then we have what's called go, no go tasking. So basically, hey, if an apple pops up, you're going to hit 1. If a banana pops up, you hit 2. If a popsicle pops up, you hit 3 right on a keyboard. So first we'll test them with, do you understand that? How long does it take you to process? Is that an apple, a popsicle, or a banana? Then the go, no go tasking is, same, you have the same 3 things, but this time you're only gonna, we only want you to hit a button if an apple comes up. And, and so then, the banana pops up and either they can't not hit a button, right? Or it's like, they're still hitting way slow when the apple picks up. So there's different ways to look at it. And again, these are different, a little bit of different pathways. So again, you can't just look at one, but I mean, if all 3 of them are super tanked, I mean, then you're like, driving for you is going to be a danger, right? Just because you're not going to be able to get out of the way. And it's important to, of course, we see a lot of, sports concussion stuff. And, it's when do you return to play? Like, dude, if your reaction time is that slow and you're playing hockey, forget it. Or, something that, is or football or whatever, you want your reaction time to be, up to speed. And it's hard to rehab reaction time. It's not something that there's not like, just a simple like, oh, do this a few times and man, your reaction time is going to be great. It's such a complex thing because that has to do with metabolics and it has to do with, training and, and that kind of thing. But with the visual, I would guess
that's a much longer recovery than you would typically have for.
Yeah. Reaction time is, sometimes it's like the last thing that clears up, because your brain basically wants to keep you out of danger, right? So like if you're feeling unbalanced all the time, right, then brain is like, dude, we got to figure out like where you are in space. We got to figure out where everything else is in space. I'm spending all this energy just trying to keep you like upright and like not, running into walls. And that's metabolically really expensive. And that, your brain is draining the battery pretty quickly when that stuff is off. And people feel terrible, when their vestibular system's off. And then, same thing with ocular motor, so while you're awake, your eyes are open, then that system is getting super taxed. So, you've got people looking at computer screens all day or, or whatever they're doing. I mean, you could be a welder or whatever it is. I mean, you're visually focused on something, we get eye strain and headaches and all that. And that's going to drain your battery. If you're having to, let's say, going from this thumb to this thumb and the eyes are making it here, and then it has to make another jump to here, right? Because it's the accuracy is off. So now you're spending twice as much energy to get to a target, so to speak, right? And so, again, it's metabolically super expensive. So we work on a lot of that stuff. So it's, that there's kind of vision therapy and there's, vestibular therapy and then, joining them together and things like, gyrostem and stuff like that. Again, the metabolics, hyperbaric therapy, ketone therapy, laser therapy. We've got, we're usually ahead of the curve on all that stuff.
We'll talk about those. That was going to be my next question about the hyperbaric, sure. Oxygen therapy and ketones. Like, how does that work? Like, what does it actually look like for someone who's getting it? And how does that address the metabolic cascade or work to, I don't know, put up some barriers to slow that down or to get it back on track? Could you talk about that?
So I coined the whole hyperbaric oxygen ketone therapy. And that was because, again, I'm a researcher and do lots of studying. And so when I decided to put hyperbaric therapy into the practice, one, it was, okay, well, do I want a hard chamber or a soft chamber? So you're talking about, atmospheric pressure. And, how deep of a dive does somebody need to go? Because a hyperbaric chamber basically puts you under pressure. And so it's like, going underwater and creating pressure. What the pressure does is it allows oxygen to sublimate or get dissolved into plasma. So normally, we're just sitting here at, sea level or whatever, and, our hemoglobin is full of oxygen. And if you breathe in 100% oxygen, your percentage isn't going to go up because your hemoglobin's already full. If I put you under pressure, then even though your hemoglobin's full, the oxygen can dissolve into plasma. And then now you've got free oxygen in the plasma to help repair tissues and things like that. So through the research that I did, I found that 1.3 atmospheres gave the most symptomatic relief. And it's also super safe. So when you go into like hard chambers, there, you've got more issues with, eardrum issues. You've got more optic nerve issues. People's vision changes for a while. You got to put a big, huge thing on your head, and it's uncomfortable. You're probably in there with 8 people, and it's just, it's not comfortable either. So we have like a 2-person chamber. It's humongous. We can get like huge wheelchairs in there, like motorized wheelchairs, or you can just lay down and take a nap. I mean, we had our hockey guys in here, and they're pressed for time because they're only here for a day before they go play, and so you'll get 2 huge hockey players laying in there right together, so we wanted to make it really comfortable so that it's not claustrophobic, right? You can almost stand up in these things. So we're adding in extra oxygen through an oxygen concentrator. But the big thing is, with all the research that I did, is that, you want to be, I'm always thinking like, how can we be neuroprotective? And so one of the things is that you have to be careful with hyperbaric therapy is seizures. And some people develop seizure disorders with concussions, and they may be transient. They may not, be then lifetime seizure issues, but we definitely see people that I started having seizures after my concussion. And the research shows that exogenous ketones, and I'll explain that in a second, introduced prior to entry into a hyperbaric chamber will prevent seizures. So I said, well, you're almost like the lawyer. Well, I better CYA. So we're just going to implement this for everybody. right? And so then, so I'm implementing it really more CYA, but then all of a sudden I'm like, whoa, like people are getting like way better, way faster. So now let me start, so then I started doing even more research. So there's no research that marries the two together. But I was talking with the company that we use to, for ketones, Dr. Kieran Clark, who's a professor, PhD in Oxford, England, right, at Oxford University, that she came up with the first bioidentical exogenous ketone body that you can take orally. Did a lot of talking with her. They're doing a lot of work with the VA for, taking ketones prior to deployments, and they're seeing that it actually has almost a prophylactic, or preventative type thing for concussions, and people recover quicker, right? And we're talking about, Navy SEALs and, people like door kickers and all this kind of stuff, right? I did do a presentation on marrying those two together, and it kind of took a little bit of a national hold. So now you've got a lot of like the long COVID clinics and, these clinics that were all using hyperbaric therapy, now all of a sudden, they're doing the ketone therapy along with it. So, and we see just tremendous ability with that, because when we go back to that energy crisis, right, and we've got the glutamate, we can't get the glucose in, ketone bodies enter Krebs cycle without any problem, and then just create energy. And they're super anti-inflammatory, and they're just great for you. So like a ketogenic diet, so like, people have heard of that, where you're eating like primarily fat and you go into ketosis, you're creating your own ketone bodies. People hate doing that diet. It is an inflammation crusher, and we do, depending on the person, like that, may be something that we recommend for a little bit. But, we for sure want to get the ketone bodies in when we're doing hyperbaric therapy. And so we do use that a lot for like long COVID patients and, back injuries and stuff like that. But really, it's been great for all of concussion recovery, making it a lot quicker. And because the body is so fueled up, like if we're doing, if we're working with somebody who needs like an intensive program where we've got them here for, 3 hours of therapy in a day, like we want to make sure they're fueled up in the morning. So they'll come in at 8:30, spend an hour in the chamber, and then we can get a lot more done that day, just because we have more energy, right? So that's the scoop with the hyperbaric therapy. And then recently we added in Erconia lasers, which they've got red, green, and violet. So when you get into the mitochondrial function, which I won't bore you to death with, there's 4 complexes, and the red hits 2, green hits 1, purple hits the other. And so it just supercharges your mitochondrial health. And so we start repairing mitochondria that way as well. So we have there's a concussion protocol. There's all the stuff, and they're working with the VA doing all the concussion related stuff. So the lasers are great for like pain. So whiplash, neck stuff. So it's great for that. But the next step that they're doing right now is they're working with the VA doing all these different studies on the lasers for brain health. And so of course we're using it because this is what we do. And it's incredible.
Does that have anything to do with what you see kind of, newer kind of trends, at least commercially or consumer wise? Red light therapy, you see like, is that something completely different? Okay.
Yep,
gotcha.
Different. Yep. So these are actual cold lasers instead of like infrared light. And so it's super targeted. You have to be a medical provider to be able to buy them. Right. So anything you can get on Amazon, or if you can go, all these places are popping up now, which I don't know how long they're going to be able to do it, where they've got, float therapy. Okay, fine, whatever. Red light therapy, whatever, cryotherapy, good. It's not that these things aren't good. They definitely have their benefit or whatever. I think they're trying to implement some of the hyperbaric stuff, which, at the very beginning, I had to make sure that we were okay to do hyperbaric therapy. So I'm not really sure like how they're getting away with it right now. I have a feeling it'll probably close down, at least that you have to be a medical provider to be able to do all this stuff, right? So, there is the difference between, things that you can just buy as, a lay person, than, things that, you have to have a degree to be able to buy. And, the difference is not only, we spend $60,000 on a laser unit, $200,000 on a gyrostem, $20,000 on a hyperbaric unit, right? I mean, so sure, you can go get, they'll claim some of the same stuff, but, it's just not. And it's not that they don't have benefits. I don't want to say that, right? I mean,
right.
They do. But, when you're dealing with, with traumatic brain injuries and concussions and, and just with the amount of athletes and stuff that we work with, I mean, we want it like top of the line, like let's make sure that we're doing it right. And
how do people find their way to your practice? I know what we see a lot of in the statistics I've seen show that someone goes to the ER after a car crash or just to the ER in general for any kind of injury. Concussions are one of the things that are missed, or mild traumatic brain injury is one of the things just missed completely. And I see that so many times. Like, well, did they ever ask you any questions about your head? No. They asked me if I hit my head, said no, so they never followed up. So, I mean, how do people make their way to where you are? Do you see people who aren't getting help from the traditional avenues? Or I've heard you say a lot about athletes.
Yeah, pretty much. I mean, I don't do social media and stuff like that. So we're largely word of mouth. We've got a pretty good, website, developer and all that kind of stuff. So, definitely Google searching and stuff like that is probably the top way that people find us. But definitely word of mouth where, somebody will just be like, oh, man, I'm not recovering from this thing. And it's like, oh man, my son or this or that is the only place that helped was Carolina Brain Center. You need to go talk with Dr. Dane. And, so then we get people in like that. We don't build a book of patients here, right? I mean, like when we're done with somebody, we're like, if you need follow-up care with a chiropractor, like go find somebody. I mean, you know what I mean? So like we're constantly, we have to have new patients coming in because we want to fix you and get you out of here. And so, when you leave, we're like, we love you and we hope we never see you again. And we mean that, like, and all with as much love as we possibly can. And of course, if, you get another concussion, you know where to come. But, hopefully we got you set up and, you're out. That's good. So, I mean, it is unfortunate that, there's always been the whole, MD chiropractor and, and I mean, they'll be okay with, if you get a little whiplash, go to the physical therapist first, and, maybe go to a chiropractor, but there's just always been the row, and it just is what it is. When you first graduate, you get all offended by it. Now I'm just like, it's fine. Like my patients get so mad. They're like, oh, we went over to this place and they wouldn't even look at your reports. You've done more for us than whatever. And I'm like, it's fine. So it's good. We have a lot of documentation to back up what we're doing. So, when it does come to like depositions and stuff like that, like it's never a problem. Like, here you go. Here's the data. Data doesn't lie. So, like, here it is. Did anybody else run this testing? I mean, like what did they do for their exam? I mean, a quick neurological exam, I can tell you can do it in like 5 minutes. Like the standard, 5 minutes. That's it. We take 2 hours for our initial exam.
And what do you do in that 2 hours? What kind of things are you doing?
Yeah, so we run a video nystagmography, which is just basically like ocular motor testing. A lot of ENTs will use that for, like vertigo type stuff. We look at it differently and the same, but largely differently. We're looking at, again, the ocular motor pathway window into brain, eyes are a window into brain function. Computerized posturography with eyes open, eyes closed on a soft surface and a hard surface. So we can now assess how's your proprioceptive body spatial awareness, right? Do you know where you are in space? And it's not like a conscious thought of, I don't know where I am in space, but, when we challenge it and all of a sudden we're like, yeah, bro, your brain does not know where you are right now. Like we need to fix that. And so, and looking at it, each section, but then saying, okay, well, wow, you actually did a lot better with eyes closed on the soft surface, which is probably, what we consider like the hardest part of the test, right? But some people do better with that. And that's because their visual system Maybe their eyes are moving around all the time, which is going to create postural instability. So then we're like, whoa, we gotta really concentrate on that first, right? Or maybe you do better with eyes open and you're falling apart with eyes closed because your brain doesn't know where your body is in space, and your postural reflexes are messed up because you've had all this, whiplashy stuff. And then we also do right eye testing. So we look at reading comprehension. We look at, it's a different ocular motor test as far as like from the VNG, you're on a computer, it's smaller. What do people do all day? They're on small computers all day. So, it's good to be able to do that. But we can also test with that with glasses. Like if somebody wears glasses, you can't wear them on the VNG, but you can wear them for right eye. So we can compare like, oh, well, you know what? It's like good. Your pursuits look better with glasses. Excellent. Make sure you're wearing your glasses. That also does the reactive time, like go, no go tasking and discriminate choice reaction, all that. A test called interactive metronome, long form assessment. So we're looking at, can your brain keep to a certain rhythm? And, and then it may be that, man, when you did it with your right hand, you were like, great. And we went to your left side and whoa, it was all over the place. And, and your left leg was terrible, right? So the left side of your body is not great. We know we got a right brain injury.
Yeah.
Or, hey, you did great until we started doing cross crawl integration. So you're using, like a right hand and a left foot, and you like totally fell apart. And then I'm looking at gait at the same time. And I'm like, well, your gait's off, your arm's not swinging. So there's a bunch of different things that you're looking at. So you're combining the physical exam with the data that you're getting from other testing. From a neurocognitive standpoint, we use Cryos, which they have basically kind of gamified the testing that you do. Like if you went and did like a 3 or 4 hour test at the neuropsychiatry office, and you can do it from your own home, and it's a little less stressful, still do all the same questionnaires that are standard, and then you do the testing, and so then that'll tell us too cognitively where you're breaking down. So there's just a lot of data, and then from that data combined with the physical exam, we come up with treatments that are designed specifically for that individual. The 2 hours goes by really fast. So I
can imagine. Yeah, it sounds like you've fit a lot into that time.
Yeah, thank God the traditional neuro exam is 5 minutes because I can bang through that pretty quickly and get into the better stuff, right? Because people can be totally normal and all that physical stuff.
Right.
And so if that's all you're doing, then, oh yeah, well, your looks fine. Cranial nerves are fine. You're this, you do your finger to nose, there's no tremors. And so, yeah, you're fine. People are like, yeah, bro, not fine. Why do I not feel great? And you're telling me I'm fine. And then they go to another doctor. Nope, you're fine. Everything's good. Everything looks normal. They're not doing the test. And, so that's why we spend so much time and doing testing, like actual testing, like functional testing. Let me see functionally how things are going for you, right? And if you're not getting into the nuances, you're missing a huge part of it. So
I'm guessing we see a lot of this Glasgow coma scale. We're like, oh, well, their Glasgow coma scale was a 15 or 16. It showed nothing was wrong. Does that have any real usefulness in terms of assessing MTBI or concussion?
So that has to be done like field side, right? It has to be done like right, it got to be done like right then within really 15 to 30 minutes to really get a good assessment, right? So like when people come into my office, I never go through that scale. They're 2-3 weeks out, or they're a day out, or they're 2 days out. I can ask them questions and say, well, it sounds like maybe at the time of impact you're, but like if you're not like right there to like check all that stuff, it's never included in our reports. That's something that the EMT should do, or the ER, and even at that, sometimes how long does it take you to get to the ER?
And how long are you waiting in the waiting room?
So unless you're like bleeding profusely, seizing on the table, stroke-like stuff or whatever. I mean, it may be, you may not be seen for 2-3 hours.
Right.
So then how significant is the Glasgow scale?
How much usefulness does it really have in that context, right?
Yeah. I mean, because the brain is pretty good at recovery. So it's going to start recovering pretty quick, in certain aspects, especially when it comes to like consciousness and stuff like that, so.
I guess one last question that I want
Sure.
to be respectful of your time.
Sure.
I heard you say at the very beginning when we're talking about human optimization, and I've heard you talk about different athletes, Christian McCaffrey, some hockey players who come in. Do you have, what if somebody just wanted to come in and say, hey, I want to be a better athlete? Is there a way, if somebody comes in with no problems, is that the type of thing? Do you address that? Do you help people? Talk about what you meant by that.
Yeah. I mean, it's just exactly that. And again, just to be clear, Christian McCaffrey never treated here, but he treats with somebody that, has some of the same stuff that I have. But, so when we have, let's say you're a high school student and you're trying to get the college scholarship, right? Come on in because, if you're, it's all about reaction time, right? So if we can improve your awareness and your reaction time, think about it, an Olympic athlete, right? What's the difference between silver and gold? Milliseconds, right? You want to be the fastest guy off the block if you're a swimmer, right? And that's all reaction time stuff. So if, somebody could absolutely just call and say, hey, listen, I want to play some brain games and get my brain working better. Perfect. We love that. So fun. We've just got a lot of cool stuff here, available. It's definitely something that, if I had the time and the energy and could duplicate myself, I would, opening up just a human optimization, center would be amazing. And it would be great for everybody, right? Because, your brain's developing until you're 25. And then, you're getting into your, 20s and 30s, you're, having kids and getting your career going, doing all this stuff. Then you hit your 40s, right? And then you start thinking, man, my parents are getting old. I don't want to have that issue, right? So really people should be doing this stuff. I think we just did some stuff on our website. It's look, it doesn't matter what age you are, you should definitely be getting baseline testing just in case you get a concussion, right? Also, based on your baseline testing, what if there's something you could be doing now in your 20s that is going to help you when you're in your 60s? I do all of my brain stuff here. I'm in the gyrostim. I'm, doing hand-eye coordination stuff. I got to keep my brain healthy and going. And exercise is hugely important. Movement's the biggest, is the biggest stimulator of the brain. So, even my job is really considered sedentary. I may be walking around my office and whatever, but I still have to go out and exercise and, do things that I can do. So yeah, human optimization. You get one brain and people just, they wait until it breaks down. You don't appreciate it until something goes wrong. And, and it's hard to get the word out there of you need to be doing it now. Do it while you're healthy. Get that, get it going. Because,
ounce of prevention, right?
Yeah, big time. So that's,
wow.
So it's, I get to play with brains all day. It's the best job ever. It's super fun.
Yeah, that sounds pretty awesome.
I can't complain. My dogs come to work with me every day. We get to help people out, watch people change. Anytime I change staff and they start watching it, they're just like, oh my gosh, that person walked out a completely different person in one visit. I'm like, yeah, I know. It's amazing, right? So
yeah, I think that's what's so cool about what you're doing is you're not just willing to accept the status quo and just do things the way that they've always been done. You're trying to learn and you're trying to, push to help people get better. I just think that's just something to be applauded. And I really appreciate the time that you spent with us today. I know you're busy and this is time you could have been spent doing, probably 1,000 other things you had to get done.
That's right.
Thank you so much.
We love educating folks, so that's part of the deal. I think of being a good practitioner is education. So we appreciate you reaching out to us and allowing us to be on your program. And so, if you ever want us to come back, just let us know.
Yeah, absolutely. We would love that. I'm sure. I feel like I just took a introductory level, college class or maybe master's level class, because I'm gonna have to wrap my brain around a lot of that, do some more research. But I'm very thankful. I feel like I learned a lot today.
Yeah, well, there's a lot of info on the website. So CarolinaBrainCenter.com. I mean, that it touches on just about everything that we talked about. So if people are interested, they can go to that and read a little more.
Well, that does it for another episode of Mind Matters, Navigating Head Injuries and Concussions. Thank you, Dr. Dane, for speaking with us today and educating us and our audience. Remember to like and subscribe for more episodes of Mind Matters, and hit the bell for notifications. And remember, if you're in pain, call Shane, 980-999-9999.
In pain, so I call Shane, 980-999-9999. In pain, call Shane.